We'll get this
This
started.
meeting is being recorded.
Ladies and gentlemen, Kevin McNicholas, school social worker with the Gillespie School District. Happy to have you with us here today. We've got Joanna Scott from Caritas Family Solutions. She's got a great presentation for us today. Um, and then, Joanna, once you're finished, I'm going to jump on for just a few minutes and we'll just kind of update on what we're doing because I got a couple of things that I want to mention before the end. So happy to have you with us, friend. Take it away.
Hello, can everybody hear me? Good. Okay. So my name is Joanna Scott. I'm with Caritas Family Solutions. We are a agency. Oh no. I am a computer issues, I'm sorry. So my job is to find families once children go into foster care, create a family tree, and if there's a placement disruptions, my job to call relatives and find a new placement. But today I'm here more to talk about Caritas and what else we have to offer. I have a slide presentation, but for some reason I can't do my audio and vision show it at the same time, so I'm just going to present. So Caritas, we are a nonprofit committed to providing services to help families, children, adults, and seniors receive the support and refuge they need to live fulfilled lives. As agents of positive change, we build healthy relationships, loving homes, and strong communities because every life deserves love.
Joanna, not to interrupt, if you want to send that to me, I can share my screen as well and can just click through if that makes life easier. Apologize for interrupting, but if that's easier, we can
Yeah,
absolutely do
yeah.
that.
Let me do that. Let's see. Share.
I'm sorry you're having tech issues. It's usually on my end that I'm having the tech issues, so either way, it's all good.
Okay, I've sent it through email.
Take a look here. Did you send it to my school or to Gmail?
Um, the uh,
Oh, got it. Just came through. Okay.
okay.
Hmm. It's saying it's not letting me sign in. It's saying pick an account at Caritas. Do you have a login and password you want to send me?
Oh, I'm not sure. Okay, hang on. I've got a coworker that's helping me. I apologize.
No worries.
Well, the biggest thing I wanted to talk about, basically, I mean, we're a foster care agency, but what I wanted to share with you all as a group is more are the newest thing that we have, and it's called our CCBYS. So it's a comprehensive community-based youth services. So it's a shelter for youth ages 11 to 17 who are not in foster care and remain under the guardianship of their parents. So it includes runaways, youth involved with law enforcement, or those experiencing significant conflict at home. So it offers a short-term 24-hour care with case managers, nurses, and counselors on hand to ensure children are safe and cared for while families work towards solutions. So this is one of two locations in the state of Illinois. So these are kids that are not in foster care, but are not good where they're at. They're getting into trouble, runaways, things like that, which I'm assuming that a lot of you all deal with on a regular basis. So this is a new place in Belleville. You can see my screen now?
Good to go.
Oh, excellent. So yeah. So that was the main thing I wanted to talk to you about. So the youth are typically referred to the program by police officers, mental health professionals, medical behavior staff in psychiatric facilities. And then there's a phone number there that you can call to make a referral. So, so the new shelter includes 9 beds and structured as a 21-day intervention through placements. They may vary based on individual circumstances. During the time, children remain under their parents' guardianship while staff provide guidance without assuming parental responsibilities. That's the newest thing that Caritas has. Obviously, we provide, or we have adoption, pregnancy care, caseworkers in foster care, foster homes, foster parent support specialists. So that's a little extra. Licensing staff, emergency placement for youth in care, a new community youth shelter. That's what I was talking about, the CCBYS. Assisted living for low-income seniors and homes for disabled adults. So we're known as a foster care agency, but there's a lot more that we do. As you can see, our service area is over 50% of the state of Illinois. Jersey's included, looks like, and Macoupin. I'm out of the Madison County region myself, but we cover a lot of the state of Illinois. We have the adoption services where we use an individualized approach using home studies, specialists working directing with birth parents considering adoption, pre-approved families on a small waiting list, and an adoption manager out of the Belleville office. We have pregnancy options and counseling for women that are pregnant. We have our senior assisted living in Fox River. I just went and toured that facility, and it's very pretty. It's in Olney, Illinois. Everyone, all the staff and people that were there seemed very nice and happy. The foster care, obviously, that's the biggest. That's what I'm here to recruit and talk about. Obviously, you all know there's more foster kids in the state of Illinois than there are families. So we are in desperate need of more foster families. And we have a licensing staff that's wonderful that can walk you through the process of becoming foster parents and licensed. And we also have like I said, the foster parent support specialist with Caritas that can help with any issues that we have. We have support groups within our organization that foster parents can get together and talk and work through issues. So there's different types of foster care. There's fictive kin. So that's like having a relationship with the child already. Teachers, staff, social workers, people that have a relationship with the child and are willing to take them in. Traditional foster care, those are the homes that people decide to become foster parents and take in kids. Specialized foster care, those are taking on children with emotional, behavior, and medical needs. And then respite foster care, that's short term, which that's well needed. There's, homes that they just need a break. So respite care is good too. And we have the intact family services. That's where the kids are not removed from the home. But they have a caseworker that comes in, helps them with life skills and resources, community resources. The community integrated living arrangements, SILAs. So this is a group home for people with developmental disabilities. We have a few locations. The program provides adults with developmental disabilities the opportunity to live in a loving, caring home environment where they can experience independence in communities. Our residents live together 3 to 4 to a home and each have their own bedroom. They share the responsibility of managing the house. A Caritas staff member is there at all times to care for residents like they would their own family. Then we have the Youth Therapeutic Treatment Center. So this is behavioral health support, qualified residential treatment center for youth is ages 8 to 16. These are children in foster care. Then we have a teen parenting treatment center. So when teens become pregnant, and they can come here, and it's a group home for pregnant and parenting youth between the ages of 16 to 21, designed to provide therapy and community services to the youth in care of the Department of the Children and Family Services and their children. So they also have like parenting help and resources there for the team. Our youth emergency shelter. This is provides emergency and temporary placement for youth in care who have recently lost their placement. So this is a facility where they can go and live until they can find new long-term placement. Then I talked about at the beginning, and I'll reiterate again, the newly opened community youth shelter, so CCBYS, ages 11 through 17 who are not in foster care and remain under the guardianship of their parents, including runaways, youths involved with law enforcement, or those experiencing significant conflict at home. It offers a short-term 24-hour care with case managers, nurses, and counselors on hand to ensure children are safe and cared for while families work towards solutions. It allows children who are having issues with their family to be in a safe, stable, and loving place where they have the sense of belonging and peace while they work to resolve the conflict. The facility surrounds youth support while keeping parents actively involved in order to address trauma and meet the child's immediate needs while helping families find a path forward. The new shelter includes 9 beds, and it's structured as a 21-day intervention through placements. They may vary on individual circumstances. During that time, children remain under their parents' guardianship while staff provide guidance without assuming parental responsibilities. Youth are typically referred to the program by police officers, mental health professionals, medical and behavior staff, in fact, in psychiatric facilities. This is a large group of kids we have. I mean, I'm sure it's all over the state, all over the country. So we're excited. This is one of 2 locations in the state of Illinois. So we're very excited. And so I'll share my slides. There's a referral process, and I have it right there. Caritas, we have had an 84% overall client satisfaction. So proud to say that. I also wanted to share that so last year, fiscal year 2025, Caritas had 1,684 youth in care and 1,176 active foster homes. So a lot less foster homes than youth in care. But we did have Caritas. 42% of the children achieved permanency, stable homes. That has exceeded the statewide goal. So we're proud of that. Some upcoming events that we have, I added the link we've got a blood drive in Jerseyville. I know that you come every once in a while. And then in September, we're going to have a panel event at Post Commons in Alton, September 22nd, where the public can come and learn about the foster care system and ask professionals, and then there will be foster parents there that they can talk to. So I've got the links for both of those there that I'll share with you all. Obviously, we would love your donations. So here's ways to donate and ways to volunteer, ways to help. So our headquarters are out of Belleville. Got our phone numbers there, our website there. So thank you for having me. Does anybody have any questions?
Joanna, Kristen is asking, what counties does the CCBYS program cover?
Well, it's a statewide, so it's in Belleville, but I believe that anybody in the state of Illinois can call, because I think there's 2 locations. So our location and then another one, and I believe the other one may be in like the Chicago area. So anybody can call, any region, any county.
Okay, this is Kristen. It's just we used to work with another one out of Springfield, but I don't know if they still have funding. I don't know where that funding's shifting since CCBYS, I think, is also going over to DCFS for from their previous. So like CCBYS funding was originally under DHS, but then we've seen some stuff come through that it says it's shifting to Department of Children and Families for oversight. But I don't know if that's just rumor or if, and then like how we, because it is a 24/7 crisis intervention. I just didn't know if there were specific counties that you covered.
As far as I know, it's all of the state of Illinois. And as far as my understanding, um, the shelter's funded by by DHS currently.
Okay.
I don't know. There may be a switch coming, but I'm not aware of it. I know that it's under DHS right now, and so there's a hotline number that, or not a hotline number, like a 24/7 phone
Okay.
number that you can call, um, and they will direct you to what facility has openings, I guess.
Uh,
So
it's just they'd given us a interactive provider map, and so like there were like different organizations that cover different areas, I guess. Because like I'm in Coles, well, we cover 28 counties in our grant, but like I live in Coles County. So for us, that's like ICCS has the CCBYS, but it's not necessarily the shelter, it's just the service. Does that make sense? So I was just confused. I was trying to figure it out. I probably just confused you more.
you know what? This is a really good question, and I'm not quite sure. It's my understanding that it covers that it's the whole state of Illinois.
Okay.
Anybody,
Anybody can use the shelter.
as long as they qualify. I
Well,
think
fine.
there's a
Obviously.
process
Yeah. Yeah.
for
Yeah.
it.
Yeah.
Yeah.
Okay. Thank you.
Mhm.
And then, Kristen, to your point on the funding, I do know there's a lot going on right now in terms of the budget supposed to be signed by the 31st of May and all of that. So I don't think it's a question of is the money going to be there. I think it's who's going to be administering the money at the moment, because I know a lot of stuff is getting shifted at the moment. I, again,
Yeah.
it's an election year, so I'm pretty sure everything is going to get funded, but I think it's just a question of, which department is administering which grant and all that as they try to,
Yeah,
jockey for
I
position.
don't think we'll see a lot of change at our level, but I just, we're always looking for resources and information to pass on to the people that we work with. So, thank you.
Yeah.
Kristen, I will follow up with that in the email in the group, and find a definite answer for you on that.
And Joanna, that's fabulous. I didn't even know that that existed 20 minutes ago. So that's a huge resource because I feel like so much of what Caritas is doing is you're ministering to, you're catching a group that's hard to catch, as it were. You're working with a group that's kind of often overlooked, I'm afraid. More than just foster care. That's a great it's a great slogan and a great mission.
Thank you.
Absolutely. Anybody have anything else for Joanna? This was fabulous, friend. Thank you very much. And I'll look to see. I want to make sure that I'm within my days. But yes, I always try to make it. I like your church, especially for blood drives. So I want to try to make it to that. We gave a little while ago. I should hopefully be within my days, and that's over the summer. So that'll be good.
June 4th.
June 4th. All right, perfect. Perfect. And we can send that out as well in the email.
Yes, I'll do that.
Awesome. Thank you. Thank you. Um, Folks, thank you again, Joanna. Absolutely fantastic. Have just a couple things that I want to mention, and then we can break for today. Chaz Swearingen, our co-founder, left Lincoln Prairie and is now back. He is the head of crisis management services at Locust Street, which was a role that he had filled for a long time. He wanted to be here today to discuss a little bit of that, but unfortunately, he's stuck in meetings all day. So I wanted to let everybody know that that switch has been made. Chaz did that for quite a while, then moved over to Lincoln Prairie for a bit, and now is back and doing a fantastic job. Locust Street in our area covers many of our counties here in our area: Macoupin, Jersey, Greene, Calhoun, etc. So Chaz is doing a fantastic job with that. So any questions or resources, even if it's not a crisis, Chaz is a wealth of information. By all means, please get a hold of him. Our friends at Regional Office of Education 40, Ryan Wamser and Matt Weld, as always, are offering CPDUs and CEUs. That will continue for all of our mental health first responders meetings. You may have noticed that we've made the shift over to the Google group from Outlook. I always joke that Gillespie is the last Outlook district in America, or the last Microsoft district in America. So I made the choice to migrate this over to Google, and I think it was fairly smooth. We had a few small hiccups, but I just want to make sure everybody's getting the emails and everything. Works the exact same way. Email the group. If you need anything, you can email me directly or email it to the group. It's MHFRN, as in Mental Health First Responders Network, MHFRN at googlegroups.com. And please refer a friend. If you've got anybody else, by all means, let me know. We want to get people added. We have well over 400, and it's absolutely, absolutely amazing. It's been a tremendous, tremendous resource. Another thing I'm going to send out, we have a summer social emotional learning summit in Collinsville. It is free for attendees. It's geared primarily towards school districts looking at implementing either a social emotional learning curriculum or just an approach. I will send out some more info about that. But excuse me, I wanted to mention that. I will be working on that, as will Ryan and Matt with the ROE and several of our other friends and colleagues here through the network. And also, we go on hiatus for the summer. I kind of follow the school year calendar, also because my internet at home is not usually strong enough. We don't have the bandwidth to support a big meeting like this. But so June and July, we will not have meetings, and then we will start back again in August. And I'm working on getting people scheduled right now. So if anybody has any topics that they would like to present on, or if your agency is doing anything, whatever, I'm always looking for people, and you're always welcome. Never, never a problem. So by all means, let me know. And that is all I have. Short and sweet today. Anybody got anything else for the good of the group? Hearing nothing. Joanna, thank you so much again. We so appreciate you and your fantastic work. See you in Jerseyville. I feel like you and I are always on the same schedule, whether I'm catching at the library or the blood drive or out in town. So we'll see you around town, and wish everybody a great summer, whatever you're doing.
Thank you.
Absolutely. Cheers, everybody. Thank you so much.